Hello, my name is Jon Rush and I'm the Chair of North Cumbria NHS Clinical Commissioning Group. Thank you for giving me the opportunity to speak to you today about our annual report regarding the CCG and also the wider partnership and what has been achieved during the financial year 2019 to 20. Of course, the year finished off with COVID hitting our communities, which has created a really difficult time for us within our population and also within our health and care services. However, during this year, I have to say some of the things that we have achieved are in relation to the Healthcare for the Future consultation and the massive project that we undertook in terms of revamping services in North Cumbria. This resulted in maternity services being maintained in terms of consultant-led services at West Cumbria Hospital, something which I know personally was a massive achievement in terms of our community and the women and families over in West Cumbria, but also as well for our healthcare services. Again, we've also seen the introduction of the hyperacute stroke unit at the hospital, which I think again was part of the consultation process and will give a really good service to our community in terms of stroke prevention and the treatment of strokes. In the wider field, our 39 general practices within North Cumbria have come together in primary care networks and they are coterminous with the integrated care communities, where we are trying to deliver that partner-based service to our communities across the 8 ICCs in North Cumbria. Again, this is a massive achievement and a work that needs to still go on though in terms of connecting with the third sector and our communities, but also right across social care, general practice and community care where people are discharged from the hospital. It's an ongoing situation, but we've also got to make sure that we deal with the effects of COVID. And I think what we've seen is some really innovative working right across the health and social care sector with regard to how we are linking in with virtual consultations and also the ability just to do the organisational work that the CCG and wider partners have to do around meetings and the time delays that can occur by meeting in person. Also this year has seen many structural changes in terms of the way we deliver services across North Cumbria. The merger of Cumbria Partnership Foundation Trust with the Hospital Trust has meant that we've now created an acute and community service right across the North Cumbria footprint. This has also been enhanced by the introduction of Cumbria to the Northumbria Tyne and Wear Mental Health and Learning Disabilities Service, an outstanding organisation which had an early impact in terms of reducing the time delays for young people to access mental health services within our area. So we know that we've got a challenge on our hands as regards how we all adapt to services, and as well within the general practice we have created the opportunities for extended hours where there are 39,000 more GP appointments across North Cumbria through that process, and also with the support of our out-of-hours service, the Cumbria Health on Call, we are able to deliver 24/7 primary care services supplemented by the 111 system right across North Cumbria. As regards the CCG, we were rated as good in a CQC assessment, and when you look right across all the different organisations within North Cumbria in terms of primary care, in terms of our care homes as well, and in terms of some of the services that are offered from CHOC, as I said earlier, and also the Mental Health Trust, we are rated good or outstanding right across all of those. There is obviously some challenging work to do with the hospital, which we know we will work together hand in hand to make sure that we can achieve the very best services for our community. We know this is not going to be an easy task, but it's one which the CCG, working in collaboration with all the partners, including social care and the third sector, are determined to achieve. And looking towards the future, I think what we've got to try and do is make sure we can stabilise the services within the acute hospitals and community sections there, but also as well at the same time trying to develop population health, health inequalities and preventative campaigns right across the North Cumbria area, working with our general practices, the third sector and the county council, and as well supplemented by our continuing access to community groups who provide very special hands-on services such as carers and individual carers at home who take a massive amount of work away from health and care systems in our community. So the next year is one of challenge, without a shadow of a doubt, but one that we are determined we will succeed in by working in partnership, not only in North Cumbria, but also across the wider integrated care system in the North East and North Cumbria, where we will continue to work with our large providers at Newcastle and Northumbria, and also as well within the various clinical commissioning groups right across the area. One has got to remember that from the CCG's perspective, we are the ones that look after and see the whole of the system right across North Cumbria, and also as well with our CCG partners across the North East as well. So we've got to make sure that we can continue with those and make sure that they are delivered effectively. And one final point, we also have the responsibility for continuing healthcare. For those people who cannot access hospital care but need to be cared for at home, we have got a challenge to make sure that we deliver a careful and effective service and a sensitive service for those people who have been particularly hit hard by COVID with maybe access to some of those services. So all in all, I'd have to reflect back on 2019-20 as being one of change, as being one of facing a pandemic, but also being one that gives us hope that as we work through the next 12 months, we can produce plans with our partners right across North Cumbria and the North East that will make sure that our communities get the very best service that they deserve. Thank you.